So now coming to the posterior circulation, think of the posterior cerebral artery as picture from the posterior, and remember cerebral for cranial nerve 3 or for contralateral hemiparesis. Now that's the way I like to remember it, because what it does is it leads to contralateral homonymous hemianopia with macular sparring, since it has a dual blood supply. It has elixir without agraphia, that is, you can write but you can't read. That is the most important. And the patient would complain, or his attendant would complain, that he can see familiar faces but can't identify. That is one of the high yield points over here. Coming to the basilar artery, it's already written that it's locked in syndrome. What's most important here is quadriplegia, that you should know. It's loss of all the four motor cortices, and leads to motor defects in the upper and the lower limb along with the torso. The patient is conscious if the RAS is preserved, and there is a loss of horizontal but there is no vertical eye movement. For the anterior inferior cerebral artery, I like to remember as ICA as facial. It doesn't make any sense, but you have to memorize it. Just know that ICA most dominantly involves the facial nerve, and they like to confuse it with the posterior inferior cerebral artery. So every other symptom is the same, or the sign is the same. Just know that it involves the facial nerve nuclei. Since the facial nerve nuclei, there would be paralysis of the face that would lead to entire facial dropping. Whereas in an upper motor neuron lesion as a stroke, it would not, right? Remember, there is decreased acclimation, salivation, and taste from the anterior two-thirds of the tongue. That is the most important over here. For the posterior inferior cerebral artery, everything else is the same as ICA. Just remember that it affects the nucleus ambiguus, the cranial nerve 9 and 10, which leads to dysphagia and hoarseness, as this mnemonic denotes, that don't pick a lame horse that can't eat. So from pica, it's pica. Lame is the lateral medullary syndrome, also known as the Wallenberg syndrome. Horse is for hoarseness, and eat is for dysphagia. The anterior spinal artery is the most interesting. If you ever see a case where the patient complains that there is a paralysis of the upper and the lower limbs contralaterally, that is most commonly an anterior spinal artery with decreased proprioception on the contralateral side. And if there is hypoglossal nerve defect, that is tongue deviation ipsilaterally, that is diagnostic for ASA. And just know that as written over here, Ant's law of M&Ms at anterior spinal artery causes a medial medullary syndrome. That's all you need to know about the posterior circulation.